Welcome back to this final episode of our discussions with Adam Halpern of Wave On Health. We've talked Wave On Health in general. We talked about business basics, some marketing, becoming a founder CEO, the differences there, and just the mentalities required to get behind that. And then we talked about this a little bit in our original episode, which we'll link up, but just the athletic training evolution that most likely needs to take place with just a lot of things happening in the profession, education, and everything like that. But where Adam sees that going, obviously, with your work on creating Wave On Health. So I thought to start, we could revisit the AT chat question of where do you see AT going in the next 5 to 10 years in all the work that you've been doing?
That is a loaded question, right? As we all know. And I'm saying this to you, I'm saying this to the listeners. This is my kind of experienced answer, obviously my biased answer, but it is out of respect of what we all do. So if we look at the value that we bring, if we don't change our narrative on a global scale about what value we bring, and we continue to try to compete with spinal cord management and we need to be on the field for coverage, or if we focus on we can do rehab and dry needling, we're doing the same service as other disciplines and we're not separating ourselves. That those other disciplines have sometimes a larger toolbox, or they're already established, like EMS, that is already funded by taxpayer dollars, that if we don't change it, I think we will start to get squeezed out of traditional settings. And then athletic training might exist in industrial or tactical or military in a new form. But that's really not where athletic training was conceived. It was obviously conceived in the athletic setting. And I just don't feel that the profession as a whole, and I'm not pointing fingers to any organization, any association, or any people particular, but I don't think we're changing our narrative that meets the demands of what athletes need and the gap that athletic training fills. So I think there's a strong possibility that in 15 years, there might be a couple athletic trainers at high schools, at colleges, just because the fundamental financial model that we try to hang our hat on every day doesn't really work anymore. People are picking it apart.
I know we've run into a lot of issues, and I say we as the global state of Wisconsin. A lot of what has been done traditionally is the outreach from the hospital or clinic model, and we've had some major hospitals and clinics decide that that wasn't worth it anymore. Somebody decided that that wasn't a revenue stream that they thought was useful versus the expense, and it's left a lot of people ATs scrambling for jobs, people looking for service. At the same time, there's been ones where they popped up an occupational one because it's more readily reliable, I guess would be the way to say it. So yeah, I could see that.
And part of like my perspective is it is now 2024, almost the end of the school year. And what worked in 1985 does not work anymore. Like, it's really about evolution. It's not about change. It's not about saying we're doing anything right or wrong. It's really just saying, you know what? We have to adopt new methods of our service delivery that matches the economic times, the technology times, and to say, well, we're really valuable to stand on the sidelines for every practice. We don't have to do that anymore. Like, there's a lot of different ways to present value, to present return on investment, cost savings to athletes or school departments. And literally, we're all on the same threads. We're all on the same social media chat boards. It's the same conversation that has been happening for 30 years. There's really no different conversation from what the athletic trainers were saying in the 80s to what they're saying now. It's the same stuff because no one's created an alternative solution. It's the same thing, just regurgitated with a different wrapping paper, but it's the same package inside. Nothing different about it.
Yeah, it's such a double-edged sword. If you want to be there, we say we want to be there, but then at the same time, it's the discussions about hours and inability to do it all as one person, which is I don't think is wrong by any stretch of the imagination.
Yep.
But hard when you also say that that's what we do.
Well, I mean, a lot of athletic trainers don't like to admit it, but we're just an expense on the budget. We're not a revenue generator.
Right.
So until the people that are making financial decisions figure out a way that we are a return on investment instead of an expense, they're going to be questioning, why do I have an athletic trainer standing on the sidelines of every sport? And I literally watch them work on their phone all day. And yes, when there's an injury, there's value, but we all know as athletic trainers, we are sitting around not doing a lot more than dealing with emergency catastrophic injuries. That's just the nature of the beast. And that kind of goes into the value that we bring as athletic trainers is we're just giving access to advice and support, and we're navigating the health of athletes. And that's what no other discipline does. And until the profession sinks their teeth into that concept, because we fill a gap that is very, very open and transparent in the marketplace, and we just focus on that one skill set, nothing's going to change. We're going to be in the same boat in the next 20 years because we're not creating a different solution or an alternative to what is currently going on.
What do you see? You kind of, I think, covered it at a high level, but the next needed for that next evolution, and where you go from that expense to that return on an investment.
That is the challenge. Kind of the return on investment is the cost savings of having either one or many athletic trainers doing the same workload. How can the integration of technology improve the efficiency, improve the scalability, and level the playing field for all athletes? So then that might decrease the healthcare costs of athletes, in this case, the traditional sports setting. Because sports injuries have a $20 billion healthcare impact, financial impact, from medical costs, time loss. Like, that's a real study. And athletic trainers need to figure out how can they capitalize on being part of that $20 million financial spend decrease. How are they keeping athletes out of the healthcare system instead of focusing on third-party reimbursement?
Have there been any foundations that have been laid for people to get there? And I think this kind of goes into we were having this discussion offline of, and I even saw the argument on LinkedIn today of, the return on investment, you're saving the school money, but ultimately, if somebody gets injured, and think big universities that actually have money for this, odds are they're probably not going to be shipping them out to an outpatient PT clinic and covering all those medical bills. They'll figure out another way to not have to spend that kind of dollars. So yes, you are maybe saving that, but it's probably not an investment that would have happened anyway, to a certain degree. We talked a little bit about, you mentioned third-party reimbursement as a thing that's, been going on for a while, still hasn't quite got there. Some places, yes, some places not as much, but not well, to anything I've seen in the traditional setting. I believe there's actually currently lawsuits going on about that, from one that tried to. So has there been any foundations that you've seen, or what would be those initial steps, do you think?
I would say some of the alternatives in the marketplace are the complete integration of technology that utilizes either AI or chatbots to replace athletic trainers. And that's not beneficial, obviously, for the profession. And that's kind of my point, that if athletic trainers don't figure out how they adopt technology, How do they make it part of their delivery model? How does it make it more efficient for the athletes and the coaches and the schools to have access to athletic trainers? That's another reason why we're going to be obsolete, because technology is taking over in a lot of different forms. So it's a hard question to answer until there is a company that proves this is how we're either doing a return on investment or this is how we're improving efficiency. But if we talk about the healthcare perspective, when an athletic trainer is standing or sitting in a cart, in a gator, sitting on the bleachers, waiting for an accident to happen and a catastrophic acute injury, when the injury happens, they're practicing at the top of their license, which is good. But if nothing happens, they're literally not even practicing their license. They're practicing sitting on a cart. And that's where athletic trainers need to realize, how can I be effective to athletes when there's not a catastrophic injury, or when I don't have to put my hands on them? How can I help this athlete continue to be healthy and active? Or how can I continue to help them be competitive without myself as the athletic trainer wasting countless hours waiting for something to happen? And then I'll be very transparent. And then all I do is complain on social media to other athletic trainers that understand and feel my pain and give me thumbs up, like heart emojis, because they know, yeah, someone needs to change it for us. Well, there's solutions out there. I'm doing it. And a lot of athletic trainers just want to, poo-poo on it because it's not the traditional model. So
I know there's been discussion. I had this with my AD or AD that I've worked with. It's the coverage versus care model.
yep.
I would argue our value is so much higher in the care option, just because you're hands-on working with athletes, then really benefiting, like, understand the importance to a degree of the coverage. But like you said, how much time is not well utilized just by physically being there when maybe it wasn't necessary for all the things to be there. Kind of to follow up on the technology, just as you've been going through everything you're doing, obviously it's convincing athletic trainers that this is a good path to go and can be useful. What about convincing the other side, the patient or the athlete or the user, that they can still get a decent, get high quality care through a different platform than physically trying to be able to see the person? If there's roadblocks to that outside of just not being able to get in to see the person physically because of the demand on their time.
Yep. That's obviously a marketing education situation that can be overcome. It's not easy.
Right.
And I wish I had done a little bit of research on this just to be more factual. But think about just the term telehealth,
Yep.
telemedicine. That was not normal behavior maybe 10, maybe 20 years ago. Now everyone is used to it. COVID obviously had an impact on it. But even before COVID, people were starting to adopt the concept of, I don't need to go drive across town, sit in a lobby, wait to see my provider just to tell them, I have a runny nose, I have a cough, can you prescribe some medicine? And I go pick it up at the drugstore.
Yep.
And that's kind of the same model with athletic training. Yes, we cannot evaluate a possible torn ACL virtually. I get it. But that's not what we're trying to do. There's a lot of minor aches or pains or discomforts that all people want to do is have access to a licensed allied healthcare professional, which athletic trainers are, to say, hey, this is what happened to my ankle. What do you think? How bad is it? What should I do next? And that's where athletic trainers just have to realize technology is an ally. It's not a competitor unless we don't adopt it, and then it will be a competitor. And that's what we're doing. We're just trying to scale the 1-to-1 ratio that exists right now in athletic training, which is that in-person, one athletic trainer to one athlete, to one sport, to one school, to one venue. Without technology, that's never going to scale. And that's the limitation of athletic training. If we incorporate technology, which we are, it then becomes one to many or many athletic trainers to many athletes.
Sure.
And that's what's happening in telehealth and digital health, behavioral health. Even orthopedic surgeons are utilizing these components. And for some reason, I wish an athletic trainer could really tell me the reason why we're the only profession that can't do it. But everyone else can do it. But athletic trainers are like, no, my hands on every athlete is what's important. I'm like, all right, you're a dinosaur and you're going to be extinct soon. I'm like, it's up to you.
I think getting past that initial of like, yes, doing the full on
Yep.
acute injury eval
Yep.
is, I could see that being a huge hangup because yes, you can't do a virtual Lockman's and it's hard to get the person to re-imitate it for you. But I, agree. Just again, wishing we had numbers and could have done this. What's the chronic ache and pain, discomfort to acute injury, seeing ratio where again, so many of those things we managed and done so, I think, in a good way through a different route than the traditional get your
No.
hands on everybody.
And when you say that and how I answered it, it kind of answers either a question you had earlier or just a thought. And this is really for the audience. We
Yep.
are not trying to replace athletic trainers at football because we understand the value of athletic trainers at high risk contact sports. Like, we're not trying to touch that. But how many schools from high school all the way up to college have their athletic training staff cover football and the golf team, the swims team, the field hockey team? They don't get the same level of support because they're Olympic, they're non-contact, they're non-money making. By leveraging technology, we're giving the same level of access to all athletes. And when something does require the hands-on evaluation or hands-on programming, you just schedule it. So technology just becomes an athletic trainer triage model. And
Yep.
right now, there is no triage. Athletic training, I've said this for a couple months, is the most inefficient profession, I think, on the planet. If you go get your car wash, there's a technology platform. If you go get your oil changed, if you go to the grocery store, if you get a haircut, if you go to the gym, there's a technology ecosystem that streamlines that process. Athletic training is so fragmented. There's all these different apps. There's all these different rooms that we have to go into. And the main platform of athletic training is each individual athletic trainer's brain or eyeballs to remember what they did with athlete XYZ 2 weeks ago. It's crazy to me that it hasn't really reached the level of sophistication like every other, not just healthcare discipline, but every other profession in the country. It's very, very odd to me how it's kind of stuck in 1985. It's all part of the same problem.
Hadn't thought about it like that, but definitely see where you're coming from. Kind of the last topic, and you brought it up just in your answer there, so it transitioned nicely. The idea of access, it's a very big stat that goes around. 33-ish% of high schools just don't even have any access to an athletic trainer. I think it kind of breaks down almost into those thirds. A third half is a full time, a third has some access, and a third has none. There's obviously been more and more statements coming out about the NCAA and working in collegiate, to the point it got talked at the convention for D3 this past winter. And then the joint statement just came out about it from the NATA and I believe the ACSM. Thoughts on, technology again, as it just to reiterate your point maybe about using it for an access point.
Yeah. I am going to say this about the 1/3 of the high schools in the country don't have athletic trainers. And athletic trainers are not going to like to hear this. It is true. And a lot of those are never going to hire an athletic trainer. And yes, there's, 55 to 70,000 licensed athletic trainers in the country. And why can't they all hire an athletic trainer? And we want every school in America to have an athletic trainer. Sounds great. On paper, it doesn't make any sense. And there's two factors. Number one, those schools are so small, they don't have the budget for an athletic trainer. I personally went to one. There were 43 kids in my class. We are the biggest class ever. It's in rural northern New Mexico. They're never going to hire an athletic trainer. Sorry. It's not a 5A school. They don't have the same strength and power. Maybe there's a broken arm every 2 years. There was hardly ever concussions. Like, there's no reason to hire an athletic trainer. And then number two, and this is where athletic trainers literally don't think about anything but themselves and why they think we're so valuable. Some of these towns across the country that have 1/3 of these high schools are so small, and the town is so small, an athletic trainer is never going to move to that town unless they grew up there. You're not going to take someone out of Chicago and move to a small town in Illinois. You're not going to take someone out of New York City to move to northern New York unless they're from that town.
Sure.
So you have to really change the perspective of, okay, there's all these student athletes across the country that don't have an athletic trainer, but how can we provide access to an athletic trainer? And the only way to do that is to incorporate technology. And we literally just did this with a school in New Mexico. 1A, smallest division, worked with an athletic trainer 400 miles away, saw great results, evaluated it, gave them personalized program, was available for access, and the athlete competed in the state track meet. Could they have done an ACL Walkman? No. But could they have connected them to someone locally that can do it? Yes. And that's that athletic health navigation piece that athletic trainers never want to talk about. What we are really good at is just connecting all the dots. We don't have to play Jesus. We don't have to play God. We don't have to try to do everything. It's looking at where is our uniqueness in the global perspective of being an athlete. And just having access to advice and support is really all athletes want. That's it. Pretty simple.
As always, it seems simpler than it is ever in execution, unfortunately. But I like that the concept is there.
Yeah. So, and I'll say this though.
Yeah.
And I'm kind of asking the listeners, how many of you in the last month answered either an in-person question, an email, or a text message from not an athlete at your school, and you gave advice or support through your cell phone, or you talked to someone at a track meet or a baseball game or a softball game? And I bet everyone that's listening is going to raise your hand and said, oh, I did it. And that just validates all people want is access to advice and support. And athletic trainers are doing it every single day through a non-HIPAA compliant platform called their cell phone. They're not documenting anything. So they're basically going outside of their scope, and they're doing it all for free. And then all we hear on every social media platform is we're undervalued, we're underpaid, no one appreciates us, I'm tired of not making money. Then stop doing it for free. Like, it's simple. Stop giving your level of expertise away for free, putting yourself at risk by not using the appropriate resources to deliver the allied healthcare profession. Like, it's mind-blowing. Because why? People want to live in 1985 and they're not moving into 2024. And I'm kind of tired of like being empathetic about it and kind of like dancing around the reality. The problem is athletic trainers are not changing how they deliver their service. And I'm not saying it's 100% across the board. Obviously, I'm not trying to make it a blank statement, but the ones that are the most vocal don't want to change, and they want everyone to change their situation. And I've said that. What I've done is said, you know what? I'm not going to sit here and complain. I'm going to create the change that I want, and then hopefully other people follow. And we're making some big headway. We are.
Well, anything else on this topic that we didn't cover that you wanted to?
I thought about this and I didn't mention it earlier. And it kind of goes into our business model, but it's also the understanding of how kind of scary it is what I'm talking about. An athletic trainer can be amazing in person. That actually does not directly correlate to their success utilizing technology, because it's a different environment.
For sure.
So what we are now focusing on is we have to educate, train, and empower athletic trainers on how to use what we call the athlete health management system. So then they feel confident to understand how they can manage acute injuries, chronic injuries, do a telecommunication visit, how they can push out specific programming or exercises. And then they're going to start working with athletes. And once those athletes start to see the appropriate progress, outcomes, saving time and money in the healthcare system, then the athletic trainer's brain will continue to scale and grow with the technology of, oh, well, if I did this for one athlete, imagine what I could do for 10 athletes, what I can do for 100 athletes. So I know that. I don't expect every athletic trainer to have the same perspective or mindset that I do. And we're really trying to improve that educational growth for an athletic trainer to deliver their service through technology.
Makes sense, and good to address it from all angles.
Yeah. No, and it's not easy what I'm trying to do. And if anyone wants to have a discussion or really learn about it and even pick it apart, it's only going to make us better. So I'm not sitting here saying I know everything and everyone should do what I'm saying. I have gone through the ringer. I have athletic trainers shoot arrows at me every single day. They don't think it's going to work. They don't want to hear it. And I just have to put my head down knowing this is for what's best for the entire profession. And I really encourage anyone to reach out, learn a little bit more about it. We can help you advance your career. We're giving athletic trainers the opportunity literally to get paid by supporting athletes when they're at the grocery store, when they're sitting at home, when they're on the beach. I don't care. And that's how technology can really improve the athletic training service delivery model in a way that's never been done before. So.
Makes sense to me.
Yeah.
Well, I appreciate you taking as much time as you have on all of these, the series of it, and just sharing what you're doing and your insight into it. And again, if people want to get in touch with you, we'll link all that up on the episode page so they can see all that. But Adam at waveonhealth.com if they wanted to get in touch to either challenge the notion or see how they could utilize it for themselves. So again, really appreciate your time and kind of your forward and definitely your forward thinking about what the profession could be in the future.
Yeah. I mean, thanks for having me on. It's been enjoyable. Hopefully I didn't ruffle too many feathers for you and your podcast. But if we don't challenge the status quo never changes, right? So there's got to be people that are pushing the envelope, doing what's best for everyone else that is involved. And hopefully some people reach out. And I have had some people reach out. I think through the podcast, like there's people that schedule with me. They're really interested in it. So
Right.
I do appreciate your willingness to hear what I have to say, support it, and then share it with the profession. I really do.
Awesome. Yeah, and for any of those that are reaching out, let them know from us. So anything that comes from that will just help support the podcast and moving everything forward. So we appreciate that from people as well. But well, thank you again, and we will catch you not on another episode as planned at this point, but ultimately at some point in the future.
Yeah, no, thanks. Yeah, we'll see you soon.
Thank you for checking out this episode of Athletic Training Chat and our series with Adam Halpern. Please go back and check out all of them. Just a really unique insight into the entrepreneurial and founder mindset, plus Wave on Health and what might be going into the future of athletic training to make sure that we can provide the best care to patients everywhere. As always, just thank you for listening. We truly appreciate it. If you want to be on and tell your story, please let us know. We'd be happy to have you. And as always, share your story and share what the profession does and the amazing people in it. If you've ever been interested in journaling, check out the AT Daily Journal from either Amazon, $20 for softcover, $30 for hardcover, or go to clinicallypress.org/shop to check out the 14-day downloadable free trial. We appreciate it again, and we will catch you next episode.